So palliative care is really a medical specialty that aims at making sure the patient's goals get honored. We look at quality of life and what's important to the patient. Oftentimes in medicine, what happens is we as physicians determine the treatment course. That may not meet what's important to the patient. So we try to identify that. And the palliative care provider will really focus on what is important, what is quality to that patient, what are their goals, and what can make their life better. We focus on things like symptom management. For example, if you're having pain or shortness of breath, we make sure that you're not suffering from that. But also, where do you want to live? What is important to you? What kind of events are you trying to get to? And so we work to develop a plan of care to allow that family and that patient to meet that plan of care. Families are so vital to what we do. As a trained family physician and a palliative care provider, I realized a long time ago, we do not make decisions in a vacuum. It's really a system that we want to pay attention to. So that system really does include the patient and their caregiver, their family, and it's very important that we actually meet the goals of all the persons part of that system. What's really important is that if the patient wants to do one thing and family does not want to do that, then we have to figure out what is right for that patient and that family together. And it's really about making sure the caregiver is part of the plan of care. So there's not associated guilt with this. There's not associated, I should have done more, should have done less. It is very stressful no matter what side you're on, whether you're the patient or the family member, or even the provider, in all honesty. We help to balance the stress of caring for that patient by just making sure that we're available and we listen to the patient and the family. We would like to get involved in a case almost as early as diagnosis. So as that patient is going through their treatment, we're there to support them with pain management, with symptom management, but also emotionally. And then if the treatment goes well, we celebrate. Unfortunately, treatment doesn't always go well, and we're there to help pick up the pieces. We're here to support them in those changes and those difficult conversations. So we get to know that family. It's very hard when my providers and myself get pulled into the hospital at that last minute. The patient's not doing well, and we're asked to talk the family into palliative care, talk the family into hospice care. I would much rather be involved early in the course of disease, at diagnosis. I can support the family much more aggressively, much more appropriately that way.